City of Hamilton Public Health Services works with owners and operators of personal services settings to ensure that services offered are done in a safe and sanitary manner. The goal is to prevent infections. Infectious diseases such as hepatitis B, hepatitis C, and HIV can be spread during tattooing from contaminated needles and equipment. In this video, we review general requirements for tattooing from the Ontario Regulation 136 Personal Service Settings. To protect yourself and your client, it is important for you to do frequent hand hygiene and wear gloves when tattooing. Gloves must be discarded when taking breaks during the service and in between each client. Hand hygiene can be performed with alcohol-based hand sanitizer if your hands are not visibly soiled. Use soap and water if your hands are visibly dirty. Work surfaces must be kept clean and in sanitary condition. Cover any work surfaces or items that cannot be disinfected with disposable coverings. Work surfaces must be cleaned and low-level disinfected between clients. Any lubricants or creams must be applied using a single-use applicator to prevent cross-contamination. Critical items are those which penetrate the skin, such as needles. These items must be purchased pre-packaged, sterile, and disposable. Sterile packaged tattoo equipment should be opened in view of the client, only when ready to begin the procedure. Ensure packages are open in a manner that avoids any contamination of needles or equipment, and be sure to check expiry dates prior to use. Sharps must be disposed of immediately after use into an approved sharps container. Replace sharps containers when they reach the fill line. Sharps containers must be disposed of in an approved manner. Ink caps must be cleaned and disinfected using an intermediate level disinfectant, such as 70% alcohol, prior to use. Before the service, explain the procedure and the associated risks to the client. Document this on the client's consent form. Record lot numbers and expiry dates, if applicable, of the prepackaged sterile equipment used during the procedure. Assess the client's skin prior to offering service. Do not tattoo within 6 inches of inflamed or infected skin. Use distilled water if diluting inks, and never top up ink caps. Distilled water in disposable cups is to be used to rinse pigment from the needle while tattooing. Do not store ink bottles on the workstation while tattooing. All single-use items used during the procedure, such as gloves, ink caps, and disposable coverings, must be discarded into a lined garbage receptacle. Work surfaces must be cleaned and disinfected with a low-level disinfectant after each client. If any surfaces are contaminated with blood or body fluids, a high-level disinfectant must be used. Remember to provide verbal and written aftercare instructions to your client. Include reminders on how to wash their hands before touching the tattooed area, expected healing time, and signs and symptoms of an infection. Advise clients to seek medical attention if they are concerned about an infection. Sterilization must be done in an approved sterilizer. Sterilizers must be operated, monitored, serviced, and repaired as per the manufacturer's instructions for use. After each use, immediately clean instruments thoroughly with detergent and water or with an ultrasonic cleaner. Leave clean instruments to air dry. If it is not possible to clean immediately, dirty instruments should be placed in a labeled container in the dirty area of your reprocessing room to soak until cleaning can be done. Package equipment individually in sterilizer pouches equipped with temperature-sensitive indicators. Sterilize equipment and ensure packaged equipment is completely dry prior to storage. Each sterilizing load must be recorded in the logbook and must include date, items sterilized, temperature pressure, cycle length, and operator's name. Sterilization records including log sheets, spore testing, and maintenance history are recorded. Spore testing is to be completed bi-weekly, and the date of spore testing is to be recorded. Spore test results are to be kept in a logbook and available at all times for review by a public health inspector. New sterilizers or sterilizers that have been serviced or relocated must not be used until 3 negative spore test results are obtained. Failed spore tests must be reported immediately to public health services. Before providing a personal service, the client's name and contact information must be collected and retained by staff. Records related to invasive procedures must be kept on site for 1 year and retained for 2 years beyond that. For more information, please contact Public Health Services.